Over the years, scientists have conducted considerable amounts of research into ADHD. And while they haven't found a cure, they have discovered effective ways to treat and manage the symptoms. Aside from drugs, which we'll cover in another chapter, the most successful form of treatment being practiced today is what's known as psychosocial counseling. Psychosocial is the term doctors use for a variety of treatments which incorporate both the psychological and social aspects of an ADHD patient's life. One of the most effective psychosocial treatments, especially for children, is behavior modification.
Those are very helpful to people with ADHD in terms of, learning to get their work done, learning to be organized, kind of reducing their impulsive behavior.
Behavior modification works by attempting to change a child's behavior by giving immediate feedback on his or her conduct.
He did really well on using his hands right, and so that one we may just take off for next week.
During therapy, teachers and parents work together to acknowledge and encourage positive behavior and actively discourage undesired behavior. One way to do this is to establish a simple system of rewards and punishments.
He actually got an award for being a good student on the bus this year. So he got written up.
We use yellow beads, red beads, and green beads. If a child's having a fantastic day and has followed all the rules and is really good, they get a green bead in the jar. If a child has to be warned once or twice, they get a yellow bead. If a child is just horrible that day and is off the wall, they get a red bead.
For this system to work, the parent or teacher has to respond quickly and consistently to a child's behavior.
And it has to be in small doses right after the behavior. So when the parent says, if you turn in all your homework this term, we'll go to Disneyland at the end of the school year, you're just wasting your breath. It has to be every day.
Another type of psychosocial treatment is behavioral intervention. ADHD interventions, unlike other kinds you may be familiar with, involve making seemingly minor changes in an ADHD patient's life, helping to create a sense of calm and regularity. Some common interventions include keeping a consistent schedule, having the same daily routine, and keeping track of schoolwork by using what's known as a homework notebook.
If the homework notebook doesn't come home, for an example might be no TV. If the homework notebook does come home, then when the homework gets done, half an hour of video game.
Interventions have proven effective for even very young children with ADHD symptoms.
It could be just turning off TV at night, doing a bath, doing a book and calming a child down, and then putting the child down.
Should I actually do a paper tonight?
What's that paper?
It's on Oedipus Rex.
Older ADHD patients have different needs than children and therefore require different management strategies. One recently adopted approach is a type of social skills training known as coaching. Here, coaches help patients develop guidelines that allow them to monitor their own behavior and decision-making.
What if you didn't try to go from beginning to end? What if you tried from beginning to middle, but cut it up into small pieces?
Make bullet points almost?
Yeah.
People can provide that structure for children. For adults, who's going to do that? They will coach, just like a soccer coach might teach you how to kick a ball or defend a goal. They'll teach you to keep yourself organized, to get your work done.
You know me, I can't plan anything.
Well, what do you mean you can't? You can. You don't.
Coaching for the ADHD person, more for the adolescent and the young adult or the adult, is awesome because it's a one-to-one and it shows them what to do, especially in the social skills area.
Because coaching is a relatively new treatment, there's not a lot of research on it, but it has shown promise for many.
It's something that I think is very popular. Unfortunately, it hasn't been systematically evaluated like the other treatments, so we don't have strong evidence that it works compared to another treatment, but it's something that most people with ADHD find very valuable.
With so many treatment options available for ADHD, it's important for patients and their families to work closely with their doctor to determine which one will be best for them. And remember, too, that the stresses of ADHD can sometimes take a mental toll, not only on the patient, but on the entire family as well. Anyone who feels they need help should seek it. A proper diagnosis and an effective treatment plan can lead to a productive and normal life for those living with ADHD.